All right, folks, let's talk about it. 18-year-old kid, senior, down at one of these major South Georgia high schools. We love South Georgia football. Patient gets transported. Why is he getting transported? He's a running back. Big kid, fast kid, got clotheslined by a defensive lineman. Patient comes in the door, completely hoarse, blood coming out, coughing out blood, not profusely, but enough to say, yeah, you shouldn't be bleeding from your larynx or anywhere in your throat. Patient goes into the scanner. Once the patient's in the scanner, we realize there's a laryngeal fracture. What's the larynx? In common terms, it's called the voice box. So this kid had a laryngeal fracture. So patient was taken to the operating room because that's what's happening now. Once he comes out of that CT scanner, he's a little short of breath, not just hoarse, not just having what we call dysphonia, not just coughing up a little bit of blood. He starts to cough up a good bit of blood. So we get him to the operating room. We do what's called a direct laryngoscopy, bronchoscopy, where we look at the airway. We see how much trauma has happened to the larynx. So the CT scan gave us a good view because he was able to tolerate a CT scan. But you know, things change quickly when you're in the airway. So luckily for this child, we were able to intubate him with a tube into the airway. We were allowed to put him in the ICU. We gave him steroids. And once the inflammation goes down, as long as the body and that cartilage is still approximated well, it will heal well. But there are some kids and there are some adults who may have car accidents where they get a crush injury to the larynx or the voice box, which is the entry point into the trachea. Sometimes they need a trach, and sometimes they need open surgery to put little wires on the larynx to kind of put it back together. Luckily for this kid, he's going to live to run another day.